Welcome to Huddle Chats. These are 30-minute monthly conversations with industry experts talking about key healthcare trends in healthcare, or key healthcare trends. I'm your host, Jared Dashevsky, co-founder of Healthcare Huddle, a weekly healthcare newsletter breaking down trends in healthcare from digital health, policy, business for 30,000 plus physicians, providers, and other health professionals. When I'm not doing Healthcare Huddle, I'm about to be a rising internal medicine resident in New York City. Excited about that. Today's Huddle Chat will be on the rise of retail health, sponsored by Guardian MD. And before introducing my esteemed guests, I want to give Dr. Chris Seitz, CEO and co-founder of Guardian MD, the floor to talk about Guardian MD and discuss why you may find it very, very useful. Chris?
Awesome. Thanks, Jared. Really appreciate it. You guys hear me okay?
Loud and clear.
Perfect. So super, just honored to be here. I'm a board certified emergency physician. So Jared, welcome to the doctor family here. That's you just graduated medical school. Pretty awesome. Excited for you there. I myself am actually someone who subscribed to both the Healthcare Huddle and Hospitality with Jared and Blake. So when I heard that they were coming together, I was like, we got to be a part of this. So again, I'm a board certified ER physician, but currently serve as the CEO and chief medical officer. And I was a co-founder of Guardian MD, Guardian Medical Direction. Guardian MD is our platform. So we're a digital health platform that really helps non-physicians start and scale their own healthcare businesses. Our platform provides the legal resources and structure, as well as the compliance resources and medical oversight through our physician team, so that
Chris, hold on. I think you got muted. Sorry about that.
you hear me now?
Yeah, you're good.
Perfect. Okay, no problem. But yeah, so basically we provide that medical oversight and that infrastructure so that non-physician clinicians can start and scale their own healthcare businesses. We do telemedicine support as well on our platform, and really have just had the privilege of partnering with a lot of great clinicians out there to really increase access to healthcare to their patient populations. So again, like I said, we're excited to be here and helping sponsor this event. I have learned so much as a young executive in digital health through these two gentlemen. So I can't thank you guys enough for the content that you put out there. Extremely excited to be here today and learn more. I think, they always say I always think that the telltale sign of a good leader is someone who's always learning. So that's what I try to do. And you guys are helping me do that. So appreciate this and looking forward to it.
Thank you, Chris. All right, quick housekeeping. Everyone will be muted, so it's just me and Blake chatting. This will all be recorded and uploaded on YouTube after. If you have any questions, my events team will post a link, slide a link in the chat so that you could just add questions there, and we'll do Q&A afterwards. So without further ado, I want to introduce Blake Madden. He's a colleague. He's a friend of mine. He's a former healthcare consultant at VMG, founder of Hospitality, a bi-weekly newsletter breaking down, actually providing the most in-depth and spicy analyses on business trends in healthcare. He recently covered Envision's bankruptcy, Babylon going private. I think Blake's newsletter is the best newsletter out there. He also started a very exclusive healthcare executive community called The Boardroom. And if you're interested in joining The Boardroom, email me after this. I could provide you more details. Blake, thank you for joining me today.
Thanks, Jared. I appreciate it. I don't know about all that. That's very flattering, but I'm excited to be here, and it's fun you and I doing this because I feel like we talk about healthcare all the time, just off the record. So it's fun to do it officially.
Great. So you and I have written and talked extensively about retail health. Now's the time I think we should actually talk about it on a platform. So we'll start with the basics and quickly get into the weeds of things. All right. So what is retail health and why are all these retailers moving into healthcare?
Yeah, no, great question. Retail health is, really one of the biggest buzzwords and one of the biggest trends going on in healthcare right now. And really it kind of describes any kind of consumer focused like healthcare player that's entering healthcare from a consumer lens, and using healthcare as a way to kind of like boost downstream sales for, the Amazons of the world. That looks like, starting up Amazon Pharmacy or Amazon Clinic and then selling downstream, over the counter generics or whatever. So those sorts of things. Yeah. So lots going on in the space, and we can get into it from there.
Yeah. All right. So I guess in the past year or two, some of them have been doing it for decades. We've seen a lot of movement in the retail health space. And I made a quick map of what the retail health space looks like. I'll show it right here and we could nail it one by one. But I guess let's start with CVS, and then you could work your way down based off of the content you've covered in the past. And we could have a conversation about it.
Yeah, that sounds great. Actually, could you reshare that? Because I think that's kind of
Sure.
just good to have up while we talk about the various players. And like you mentioned, Jared just provided a great overview in Healthcare Huddle of kind of the retail space. And then I've written about it and covered it several times. So it's a lot of fun to think about kind of the various strategies that all of these players are kind of undergoing. So starting with CVS. CVS has probably been one of the more kind of like very major, serious like healthcare players as far as retail health is concerned. Starting with their acquisition of Aetna, which is obviously a huge healthcare health insurance plan. So they attached Aetna onto their existing pharmacy and PBM operation, as well as their existing retail footprint. So from there, CVS has really doubled down on healthcare and specifically Medicare Advantage. And because of that, the reason why all of these players are so focused on healthcare and Medicare Advantage is just truly it's a numbers game. There's an aging population. Tons of people are aging into Medicare Advantage every day. There's higher margins in the space, more growth in the space. And healthcare has inelastic demand. So if you can get folks into your retail footprint, into your, kind of acquisition funnel, then you can, sell downstream to them and kind of capture them into your referral network or into your kind of ecosystem. And so that's exactly what CVS is doing in healthcare. And you can kind of see it in their more recent acquisitions and more recent investments. Most notably, and the biggest splash play was Oak Street Health, announced earlier this year. As y'all probably know, Oak Street's a huge Medicare Advantage player, focused on kind of the dual eligibles and folks with a lot of chronic conditions. And that kind of perfectly vertically aligns and gives CVS and Aetna a great kind of primary care scalable clinic asset to bring kind of nationwide for Aetna members. And so kind of coupled with that, you got Signify Health as well, which contracts with clinicians to go perform in-home assessments, in-home evaluations, to also, work with Aetna and work within kind of like that integrated care delivery model. So from an overall kind of overarching perspective, CVS has kind of like the most comprehensive healthcare offering of these players, in my opinion.
Yeah, for sure. And if I could jump in real quick, I threw in Carbon Health because they invested in Carbon Health earlier this year. But then Blake was talking about Medicare Advantage, and I made this graphic of how like the reimbursement for Medicare Advantage works, where insurance companies, CVS, for example, are paid a capitated rate per patient, based off of like a benchmark rate, average risk score, quality bonus payments. And so essentially becomes like an optimization problem for CVS, where their whole goal is to maximize this and minimize the healthcare utilization. And by acquiring Oak Street Health, Signify Health, they could better assess risk and, really bump up those risk scores to maximize reimbursement from the government.
Yeah, great point, Jared. And this isn't a dissertation on risk scores or MA necessarily, but there is a reason why. Yeah, there's a reason why CVS bought Oak Street for $10.6 billion while Oak Street is unprofitable. Like there's a reason why. Like there are downstream synergies and downstream positive like overall effects for the larger Medicare Advantage population.
And I think what's even more interesting, CVS they were the first ones in the pandemic to start a clinical trials vertical. And Walgreens followed them, Walmart followed them. But now CVS just announced yesterday, or they confirmed a rumor that they're ending or they're going to phase out the clinical trials because they want to focus on their core business, right? And the clinical trials wasn't aligned with the long-term vision. And the long-term vision is this like Medicare Advantage primary care population, because that's where the money's at. And I'll actually be writing about it this Sunday. So quick primer for that newsletter.
Oh, nice. Yeah. Love the dig there. But yeah, so along with kind of that whole MA and like aging population and elastic demand element, there's also this element of consumerism emerging in healthcare, which has been emerging for a long time. And it's this idea that, virtual care and kind of these emerging care delivery models are more patient friendly, they're more consumer friendly. And that's also happening in MA with kind of star ratings and patient feedback and those sorts of things. So that's why you're seeing CVS invest in Oak Street, invest in Carbon, and kind of unveil and look into these kind of, the connective care delivery model and the Oak Street's customized EMR, those sorts of things. So it's really interesting. I think CVS is one of the more interesting kind of retail players. But I mean, we focused a lot on CVS already, but moving from there, Walgreens is also jumping into the healthcare game. And you can kind of see it because their retail footprint, their retail sales, and the retail pharmacy is kind of stagnant. So they needed to kind of reinvent themselves. And the primary way they're going about doing that is through investing in VillageMD, which they own. I think they owned 60% of. And then when VillageMD bought Summit Health, which has a huge urgent care footprint, a huge multi-specialty physician footprint, their ownership dropped to around 53%. But VillageMD is a huge growing healthcare asset for them and kind of helps Walgreens with their kind of entire care delivery model while also kind of protecting market share in those other segments. Moving on to Amazon, who's probably the third biggest beast in this realm. Amazon's been focused a lot on kind of like this consumer elements of retail health, like very consumer and platform focused. So the marquee kind of splash example of that was Amazon with One Medical, buying One Medical for, I think it was like $4 billion. And so One Medical had a huge footprint with employers, and it's known as kind of like this premier brand, this concierge care brand, very consumer focused. And their whole mantra has been around kind of delighting patients and retaining clinicians from their care models, those sorts of things.
Right.
Now, obviously, One Medical also had a Medicare Advantage component, which was Iora Health. I don't know what Amazon has been doing with that lately. But in my opinion, Amazon's based on Amazon's more recent moves, they're more focused on kind of like the consumer platform play. Right. And so you can see that. Sorry, go ahead, Jared.
I feel like that's interesting though, because you have CVS, Walgreens, Walmart, like they're all trying to tap into this like Medicare Advantage space. I mean, we'll talk about Walmart, but they partner with United Healthcare to offer MA plans. So like, why would Amazon be just focused solely on the consumer? Is it because they already have the foot in the door and they have access to so many customers already?
That's my guess, and I'm sure there are more experienced folks on the line that have ideas. So if you do, feel free to drop it in the chat. But my thought is that they have such a huge base with Amazon Prime, so they're kind of looking for ways to, like, the retail play, right? Like what are the downstream synergies that we can produce from investing in healthcare? And if you go on Amazon's main page, you can see, at least for me, which maybe I'm just like a freak, but my top left icon on Amazon is Amazon Clinic. Yeah, and so Amazon Clinic is the kind of hims and hers row, maybe not complete copycat, but like low acuity conditions. You can sell Amazon pharmacy services into that, Amazon RX services, and kind of bundle that with Prime. So that's kind of like the consumer facing play, healthcare play, which is pretty interesting.
Right. So I guess they got the consumer. And if they want, they can tap into Iora for that Medicare Advantage population.
And that's what I wrote about back in the day, last year. They bought Iora Health, and that's kind of like a wedge into the growing Medicare Advantage market. So, maybe they do try and partner with somebody to scale that, or, sell it to a plan, or who knows? Yep. Haven't heard anything recently, but who knows? I think there's potential there for sure.
I agree. So I guess get into Walmart Health next.
Yeah, I think, Walmart Health is really interesting. So they had some executive turnover, which I think limited their growth in strategy a little bit over the past couple of years. But more recently, they've kind of reinvented themselves, and they're targeting 75, I think it is, centers by the end of 2024. And they're looking to grow into kind of more rural areas and, attached to their existing Walmart footprints. And so it's, it's a traditional retail play in that sense. But at the same time, what is Walmart's brand? It's, it's everyday low prices, it's transparency. And so they're trying to offer really clear patient access. And it's not just kind of like a gimmick, it's like comprehensive care. It's it's primary care, it's dental, vision, behavioral, social work, like everything. So I actually think that Walmart has a really cool opportunity to kind of address rural healthcare access and also just kind of reinvent primary care, maybe just a little bit. So I'm excited to see kind of how those clinics and those pilots, especially, I think they're partnering those clinics with Optum on MA plans in Georgia, I want to say.
Georgia and Florida,
probably, okay. Yeah. So probably expanding from there. I mean, Walmart's been around healthcare for a while. I want to say they tried to buy Humana a number of years ago and those sorts of things. Yeah. So I think that healthcare is a natural kind of progression for them.
I remember being in my master's programming class and my professor was like, Walmart is starting these new, they call them super clinics. And I was like, why would they care? Like I knew CVS had the Minute Clinic, but these clinics were different. These were like actual primary care, behavioral health, like very all-encompassing care. So I've been following them for a while and I've written about them. Seems like they've had a rocky start, but this goal to double their clinic sizes by number of clinics by 2024, I'm hopeful.
No, I totally agree. I think it's a really interesting space to watch.
For sure. All right, let's talk about you covered Dollar General in the past and you wrote a very good article on it.
Yeah, I think I was a little snarky in that piece. So Dollar General, for those of y'all who don't know, is piloting a kind of mobile urgent care delivery kind of primary care clinic with DocGo. It's a pretty interesting partnership. It's with, I think, 3 Dollar General sites in and around kind of the Nashville area. Mm-hmm. And they're not using any of their kind of existing retail store footprint for the healthcare delivery. Like it's literally just like a trailer parked in the parking lot and delivering kind of urgent care services. So I actually think the model sounds relatively scalable, and Dollar General is situated kind of similarly to Walmart in a lot of rural environments and settings. I can't remember how many they have. I want to say they have like 10,000 sites or something like that. So it's really interesting. I think that we'll continue to see kind of progression of that and slow. Like I said, healthcare is a great kind of stable industry to enter and then kind of spread your tendrils in and get the downstream effects of that. And so, you see a person in a small town goes into a Dollar General, they see the trailer parked outside, they go, get a flu shot or whatever. And then they go in and buy what they need. I don't know, a Coke from Dollar General. And then
I think you mentioned in your article, the flywheel getting healthcare outside of Dollar General, going in, buying soda, coming back out and using healthcare again. CVS did something interesting once they started getting more serious about care delivery, and they stopped selling cigarettes and tobacco products. I'm not sure if Dollar General stopped doing that or if they ever did, because I know they cost more than $1. So
that's a good question. I'm not close enough to know.
Look it up. All right. And then lots of is Best Buy. I think they're just starting to get their feet wet, trying to get into like remote patient monitoring. I know they acquired Current Health. Do you know much about this?
Yeah, so Best Buy has a pretty interesting flywheel as well. And it seems like they've gotten a lot of traction in kind of like the remote patient monitoring. And recently they've really touted kind of like their hospital at home operation. And so the most kind of like notable and recent partnership was announced between Best Buy's Current Health and Atrium Health. Mm-hmm. And so basically like Current is helping to kind of set up the infrastructure and set up all the tech and help manage the program, while I think Atrium, maybe provides the clinical labor and other kind of like more intense medical services and those sorts of things. So for Best Buy, it's a nice little wedge into, an enterprise market, and Best Buy can also sell its highly lucrative Geek Squad services because, you'll have folks cross-trained between healthcare and tech at Geek Squad. So you can, go to grandma's house and say, okay, I need to set this up for you. But also, oh, your TV's broken. Oh, well, let me look at that. Or, oh, your phone's not working. Well, there's kind of upselling potential there.
Yeah.
While
Literally foot in
also
the door. I'm already in your house. Let me fix everything else.
exactly. And then Best Buy can kind of sell its downstream, like it can sell its tech products into that as well. So it's a nice little play. I don't know like how serious Best Buy is in healthcare beyond kind of this, but I think there's a lot of potential in general for folks like Current to come into the home and provide some really needed services. So I think it's a really cool partnership, and they've got several other enterprise clients.
Right. Cool. So, Blake, you're like rattled off all this information. So
yeah,
just to
sorry,
summarize,
I feel like I'm talking too fast.
No, you're the expert. So just to summarize real quick. So this is there's more to the retail health landscape, but these are the main players right here for the audience watching. We have CVS Health, Walgreens, Amazon, Dollar General, Walmart, Best Buy. They're while they do want to do good for society and healthcare, they see where the money is, and that's why they want to get into this space. So my next question for you, Blake, as we wind down the conversation, is what do you see the next 10 years looking like for retail health?
I definitely, I feel like the easy answer is everybody's going to continue to kind of hop into Medicare Advantage.
Yep.
And which I honestly think that might lead to some kind of headwinds for Medicare Advantage. Just because, there's kind of like the risk adjustment gaming and, there's so much growth and just like budgetary, elements to consider. It'll be interesting to see kind of how like Medicare Advantage growth and emergence of retail health, kind of those dynamics play out, especially with existing players, other kind of traditional healthcare players.
Right.
Secondly, I think that, there's a huge growing trend of like consumerism in healthcare. And so how much of that will kind of continue, like how consumer oriented can a patient be in healthcare, like truly, right? So I think that we're going to kind of find that out with retail health. And then thirdly, and I think there's been some notes in the comments in the chat about this, as far as, there are traditional healthcare companies, health systems that have great facilities and fantastic footprints. And they're going to have to kind of reinvent themselves a little bit because of all these emerging players that are, taking labor, they're taking techs, they're taking aides away from, traditional healthcare settings. And they're also competing for patients and competing for acquisition in the markets and for primary care and those sorts of things. So there's going to be a reaction from health systems and I think traditional healthcare players to kind of catch up to the more patient-facing, applications and consumer-oriented care.
For sure. And I think what separates these huge retailers apart from health systems, they just have tremendous amount of capital that they could just leverage to invest in new technology, to expand. What I'm interested in is to see how health systems stay competitive with these retailers moving into their communities. And, rural hospitals are shutting down left and right, and Dollar General, Walmart can like act as, that primary provider for these rural communities. So interesting trend. We'll see.
Yeah, we definitely will see. I think that the rural primary care dynamic will be interesting to watch.
For sure. And then before we get into the audience's questions, what do you think like some of the, I guess, one challenge that you think these retailers face moving into this healthcare arena? And as we know, healthcare is a different beast, especially care delivery.
Challenge. I feel like just trying to figure out like, what's their strategy and like what truly is their core competency, right? So, for Amazon, maybe IORA and Medicare Advantage isn't their core competency. So, maybe they move away from that. Or, it sounds like folks are trying to continue to figure out the various strategies, the Current Health, the Best Buy, and kind of knowing what they're good at and knowing what they're not good at. Like, I feel like there's been this big kind of like media hype around like, oh my gosh, big tech and healthcare. And here we are, a decade later, and there hasn't been a ton of movement, but
Right.
where there has been movement, there's been like very clear, tangible strategies form. And so I feel like the big tech's kind of learning and picking and choosing what they're good at in
For sure.
healthcare.
For sure. Good answer. And I actually want to use an audience member's question to segue into from the challenges to what they have to ask. So basically, George Matthew asks, do you feel that both retailers and tech companies are having a hard time realizing like that it takes a long time to make revenue in healthcare? And are they realizing this? Are they actually making sufficient revenue? Because this is technically a challenge in healthcare where you come in, you expect to make quick revenue, but it takes a long time.
Yeah, I think that folks in general probably overestimate like the runway for opening new de novo clinics or, kind of scaling tech-enabled services, those sorts of things. I will say like for folks, retail players that are like much better capitalized and like have lower hurdle rates, internal hurdle rates and those sorts of things, they can kind of like enter healthcare and create these, Walmart Healths or whatever, and use it to justify, because healthcare services in general are like produce margin, but they're also growing and there's inelastic demand. And then it brings the patients, it brings the people into their footprint. So that, it's just kind of like a mini flywheel, like we talked about.
Yep, for sure. All right. So 2 or 3 more questions. Vincent asked in the Slido chat, after tackling primary care, do you foresee these companies, these retailers opening ambulatory surgery centers? They have the provider network, capital, brand, brick and mortar footprint. That's an interesting question.
Yeah. I will say that ASCs in general are a good operation, but I feel like it just requires kind of a different beast to do that, to know, to source the medical supplies and work with the create a management company and work with kind of like the multi-specialty providers and those sorts of things. It sounds pretty from a value-based care and like Medicare Advantage perspective, it makes sense. So like, yes, like maybe they'll acquire an ASC management company or something like that, possibly, right. But it's pretty far outside, at least in my opinion, outside of their core competency to like move into ASCs. But I could be wrong. You never know. I was wrong about Oak Street Health. So
yeah, we'll see. All right. Our good friend Eric asks, do we think that the path for incumbents is to actually partner with retailers versus trying to beat them at the consumer experience game, since you really can't beat Amazon with consumer experience? It's just unbeatable.
Yeah. Eric, great to see you. Great question. Shout out to Eric. He just joined the boardroom community, so pumped to have him. But yeah, so I think that we're seeing a lot of those kind of like digital health and like kind of virtual front door partnerships between the retail Amazons and the kind of health systems. So like I mentioned, you have Current Health that's working with Best Buy to stand up. It's one of the largest hospital at home programs. Mm-hmm. One Medical had existing partnerships with quite a few health systems kind of throughout the US. So I think that health systems will, for health system admin, kind of understands what's going on in your local market dynamic. Who are the new entrants? Who are the digital health players, the virtual care players? And then, see who can do it better. And maybe you enter into partnership conversations rather than trying to build something yourself that you don't necessarily know, have a core competency in. Right. So it kind of goes both ways, right? Like hospitals and health systems have these fantastic facilities, but they are incumbent players and legacy players with existing kind of like, fax machine infrastructure, right? So maybe that opens up a space for kind of future partnerships and joint ventures.
Sure. All right, last question before we wrap it up. It's been such a wonderful conversation. Do you see these retailers, aside from Best Buy, since they're already doing it, do you see these retailers moving into the hospital at home space? Because you and I have both written about like hospital at home is gonna be like the next big thing. So do we see like Amazon, Walmart, CVS moving in that direction? Walgreens already has CareCentrix, CVS, Signify.
I think hospital at home, yes, there's a ton of potential It's interesting though, because I want to say it maybe needs a little more policy support. Like I think the waiver was extended through like next year or something. And enrollment in the programs have been just a little slow, but like from a theoretical and like economically sustainable perspective, like it's there for kind of growth. And we're not talking about them, but Emeticis and Contessa specifically.
Don't ask that question.
Yeah. So they
first to purchase them.
Yeah. Who is it? Option Care or whatever. And I wrote about that. Purchased or merged with Emeticis, and there's a lot of potential there for kind of, home infusion and Contessa and kind of those kind of services to all be bundled. So it'll be interesting to see, maybe Amazon does try to get into hospital at home and, uses its kind of Alexa subsidiary, which it has a little bit with, I think it's called like Amazon at Home or Alexa Together or something. It's like it's just more of like a monitoring, like, hey, can you check in with Alexa, grandma, those sorts of things. At least that's my understanding. But definitely a ton of potential to sell tech products and services and solutions if they want to go down that route like Best Buy has.
Yep. All right. I guess we'll see. I think there's so much potential for retail health. Medicare Advantage is a very hot market right now. I assume CMS will do something to tame the heat, and then they'll shift to somewhere else. They'll find something new. And Dr. John Taylor mentioned this in the comments. So we'll see everything. Blake, thank you so much for joining me, my friend, my colleague. Subscribe to my Healthcare Huddle newsletter. Subscribe to Blake's hospitality newsletter. If you're interested in Blake's boardroom, the executive community, just email me after this. Special thanks to Guardian MD, Chris. Thank you for sponsoring this wonderful event. And then the next Huddle Chat will be on June 1st, a couple weeks, with Dr. Derek Paul, founder and CEO of Glass Health, on how do we streamline workflows with GPT. This is the future. So stay around for that. Thank you, everyone. I really appreciate your time and attention.
Cool. Thanks, everyone, for joining. It's a fun discussion. And till next time, Jared.
Till next time. All right. See you, everyone.